Hi Brandy, my name's Annalise. I'm going to be your nurse this evening, and I'm just going to go ahead and start tonight with a physical assessment focusing on the cardiac, the respiratory, the gastrointestinal, and peripheral vascular system. So first I'm going to start with the cardiac, and I'm going to go ahead and feel your pericardium. And this is the point of maximal impulse, which I am unable to palpate due to your clothing, but that is where I would feel it. So I'm going to go ahead and start with listening to your heart sounds. I'm going to start here at the aortic, pulmonic, Erb's point, tricuspid, and mitral. Your heart sounds are good. It's a regular rhythm. I'm going to go ahead and go back with my bell now and listen for any murmurs. I did not hear any murmurs, and specifically I did not hear a mitral murmur, which if I had would have been located right here. Your S1 I could mostly hear the best over the apex, and your S2 heart sound I could best hear at the pericardium. So I'm just going to go ahead and move on to assessing your carotid arteries. So first I'm going to palpate, and that's a +2, and that is a +2 as well, and that is normal. Now I'm just going to go ahead and auscultate with my bell here. Other side. And upon auscultation, I could hear a bruit in both arteries, which is normal. So now I'm going to move on to your respiratory system. And first I'm just going to assess you here, so just breathe normally. So upon inspection, she has equal rise and fall of her chest. Her breathing is regular. Rhythm is regular. She's not using any accessory muscles to help her breathe, and I don't notice any retractions. So I'm just going to go ahead and count your respiratory rate for 30 seconds. So your respiratory rate is 18 respirations per minute, which is normal. So I know under inspection your rise and fall is equal, but I'm just going to assess for that. So can I have you turn a little bit for me? Move your hair, thank you. I'm just going to place my hands on your back, and I'm going to have you take a nice deep breath for me. And one more, please. So I'm able to see by doing this that you are expanding symmetrically on both sides of your back, which is normal. So now you're just going to feel my hands on your back, and when you do, I want you to say the words 99.
Okay. 99, 99, 99, 99.
All right, and that is tactile fremitus, and what I was palpating for are some vibrations, which I did feel, and that is normal. Now you're just going to feel some light tapping on your back, all right?
Mm-hmm.
So upon percussion, I heard sounds of dull noises, which is normal and what I would expect. I would be more concerned if upon percussion your lungs sounded hollow, like a drum. That would, notify me that there's some fluid collection, but you sound good. So I'm just gonna have you turn back this way, and I'm gonna start by assessing your bronchial lung sounds here. And when you feel my stethoscope, just take some nice deep breaths for me, okay? So upon auscultation, your bronchial lung sounds are high-pitched and sharp, but they are clear, which is normal and what I would expect. So now I'm going to move on to your bronchial sternal lung sounds. So upon auscultation, your bronchial sternal lung sounds are mid-pitched, but they are clear, and that's also what I expect. So now I'm going to start with your vesicular lung sounds. I'm going to start with the front, which is anterior, your sides, which is lateral, and then I'll move on to your back, which is posterior. So again, when you feel my stethoscope, just take some nice deep breaths. Alright, I'm going to go to your sides now. Okay, so far anterior and laterally, your vesicular lungs sound clear. I didn't hear any abnormalities upon auscultation, which is normal. So now I'm just going to go ahead and start with your back. Again, just nice deep breaths. Posteriorly, your vesicular lung sounds are also clear, which is normal. So now, when you feel my stethoscope on your back, I just want you to say the words E, E, E. Okay?
Mm-hmm. E, 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 E.
So upon auscultation, I was assessing for agophony, and I heard the words E, E, E. Had I heard the words Ah, 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 I would have been concerned for consolidation, but I heard E, E, E. And that concludes the respiratory session. So I'm going to move on to the gastrointestinal. So I'm going to have you lay down. I'm going to start by assessing your abdomen, and I'm going to just inspect it first. So upon inspection, Brandy's abdomen is flat, her contour is regular and symmetrical. I don't notice any masses or lesions. She has a few freckles, which are normal, and I don't see any visible pulsations. So I'm going to go ahead and just listen. First, I'm going to auscultate for your bowel sounds. So upon auscultation, your bowel sounds are audible and active in all quadrants, normal, active, and that's good. So now I'm going to go ahead and listen to your aortic, your renal, and your iliac arteries, all right? This is the aortic. I'm going to move on to your renal. Iliac. So upon auscultation, your arteries sound good. I did not hear any bruits, and that is normal and what I expect. So now I'm just going to palpate before we finish, and I just want you to let me know if you feel any pain or tenderness, okay? I did not palpate any masses, any pain?
No.
Awesome. So that concludes the gastrointestinal side. So now I'm going to start with looking at your upper extremities before I move to your lower, so I can see your hands. So upon inspection, her skin is normal color, it's smooth and dry, hair distribution is equal, no masses or lesions, just a few freckles. And I'm just going to check your capillary refill. So your cap refill is brisk and equal and less than 3 seconds, which means you have good perfusion. So I'm going to start now with feeling your pulses. So I'll start with the radial, and that's a +2. The ulnar pulse, also a +2. And the brachial, also a +2. I'm just going to do your other side here. So the radial, +2. Ulnar, which is a +2. And brachial, which is also a +2. So now I'm just going to move down to your lower extremities. So So upon assessment, her lower extremities are also normal color. They are smooth. Hair distribution is equal. Just a few freckles again, but otherwise no masses or lesions. I'm going to go ahead and do your cap refill on your toes. So cap refill is less than 3 seconds. It's brisk and equal on both sides, which means you have good perfusion to your feet. I'm just going to go ahead and assess your pulses now, okay? So we'll start with your pedal. And +2. And +2 on the other side. Go ahead and do your post-tibial. +2. +2 on the other side. And lastly, I'm going to look at your popliteal. And +2 here. And +2 here. And that concludes my assessment.